Well, many people suffer from neck and back pain but are afraid of surgery. Well, St. Luke's integrated a spine program that can treat everything. And here to tell us about those treatments is director of the St. Luke's Spine Program, Dr. Chirag Upadhyaya. Now, first off, what are the most common types of back pain and what causes that pain?
Yeah, thanks, Bill, for having me on this morning. So there's actually a variety of different types of back pain. It's actually one of the challenging parts of taking care of patients with back pain is that it can be caused from things like muscle strain, a weekend warrior, somebody who just pushes themselves too hard over the weekend, bad posture, or it can be things like a osteoporotic fracture because of thinning the bones, or even a deformity like scoliosis.
So I need to listen to my mom when she said sit up as a kid. I should have said have that good posture, you know, back straight, chin up. You know,
I actually tell that to patients all the time. I say that you have to go back to what your mom said about sitting up straight, and
dang it.
And then often for my male patients, I tell them to listen to their wives and make sure that they remember that they often have good advice.
Exactly. And then also, obviously, I do traffic for our morning show, so I see a lot of automobile crashes a lot. So it seems like a lot of those folks, you know, would have that neck and that back pain that I have to worry about as well. You know?
Possibly, exactly.
So, well, next up, you know, people think of neck or back pain and they think, well, I probably need, you know, injections and surgery, and people don't often want to go through those procedures. Are those the only options, or what else can people look into?
No. Those are the minority options,
really?
Actually. What we've tried to build here, as we've thought about how to take care of patients with neck and back pain, is that it's not as simple, as I mentioned, as most patients think it is. And so we've tried to bring the entire group of people together, whether it's surgeons, pain doctors, musculoskeletal doctors, or physical therapists, under one roof to be able to implement various treatment modalities that is in the best interest of that patient. And our philosophy of care is really based on conservative management. So really for us, for the most part, surgical as well as injections are the last thing we want to start thinking about. We want to start with basic conservative things like we talked about, right? What our moms used to tell us. Start there so that you can own your own care moving forward.
So almost in a way finding the root cause of that pain, what causes it and how best to treat that.
Exactly, and that's always good medicine, right? One of the first things we've learned or taught when we're in medical school is you start with the history and then the physical, and then we look at imaging to understand what is causing the patient's back pain.
So what newer state-of-the-art treatments do you guys have?
So the biggest thing that we're bringing in, aside from this multidisciplinary approach, which is fairly unique in the world of spine care, is minimally invasive spine surgery. And so it allows us to scale down the incision where we can do the incision where the incision itself is about the size of a nickel, a dime, or a quarter, depending on the type of surgery we're doing. And that often enhances recovery, decreases blood loss, gets people back to work faster, and so forth.
Is that similar to like, my mom had a surgery, and it was one of those, like with the small end of like their gallbladder or something like that. So it's just a small incision. You're able to operate everything with the, is it the cameras or something that you can see?
So some people use cameras. We use microscopes, which allow us to sort of have the microscope sitting over us, and we're looking down through the microscope, and gives us a good three-dimensional view of what's going on.
That's incredible.
So, but the key is that you're allowed to, you can do the operation through an incision, like I said, about the size of quarter, basically.
And just how long does that take to learn how to do stuff like that?
It takes a while. It took me 7 years of residency and then a year of dedicated fellowship as well, and then of course just years of practice and monitoring one outcome.
Maybe you should try that drone racing league we had on here just a little bit ago.
I did play a lot of video games when I was young, so it does help with the hand-eye coordination.
Well, there you go. Well, Dr. Upadhyaya, we sure appreciate you being here. I've turned to learn a lot, and I'm very interested in that microscopic technique. That's fascinating to me.
Thank you.
Thank
you.
For more information, make sure you call 816-932-6770 or visit stlukeskc.org/backpain and fill out a brief form online to get started. Belinda?